Hello everyone! Welcome back to our Time channel. We are very happy to have you here again.
Yes, and we have decided to go back to one of the hottest topics in skincare. It's something that everybody is dealing with. It's this infamous friend that nobody wants to talk about and who does not want to let us go.
Acne. Yes, especially now when everyone is wearing masks and add to the stress of our current environment. We really wanted to go back to basics, and for those who have joined us recently, maybe this video will help you identify the types of acne that you have and the causes of it.
And please note that we, of course, do not present ourselves as professionals. We are simply skin enthusiasts and we work in the industry and talk about many skin issues.
Before we move on, don't forget to hit the like button, subscribe to our Root Time channel, and turn on the notification. Shall we move on?
Alright, so most of us have already probably dealt with acne in their lives. We also call the common acne vulgaris. Vulgaris meaning common. You will usually call it pimples, zits, spots, and they can actually start as early as 8-year-old. But for the majority though, it usually hits around the adolescence. But in some cases, it can actually go on over the adolescence all the way up until adulthood.
Acne mostly occurs on our face, including our forehead and chin area. However, it can also occur on the neck, chest, and back. It consists of lesions in the hair follicle and its oil glands called pilosebaceous unit. So in this video, we will be briefly introducing you the different types of acne, which are papules, pustules, nodules, or non-inflamed comedones, and we will briefly talk about what are the causes. Now, let's go into details.
The most common acne types are ones that we know very well. We have the blackheads and the whiteheads. The blackheads are actually pores that are clogged but still open, and the whiteheads are pores that are clogged but closed. In terms of treatment options, both have the same treatment possibilities. You have sulfur, which is a mild form, and salicylic acid or benzoyl peroxide that are a little bit on the strongest side. These ingredients that you can find over the counter help you get rid of dead skin cells and excess oil. Topical retinoids from vitamin A can actually be very effective. If you want to know more about them, we have a whole video on the subject. You can check it out right here. Also, something that we see a lot these days, especially on social media, is the use of pore strips. These little bands that are adhesive and that you can put on your face and then rip the whiteheads with. Yeah, we don't really recommend you doing this too much. If you overdo it, it is actually able to irritate your skin and make the acne worse, so use caution.
Next are papules. These small bumps form when the excess oil and skin cells mix with bacteria. Consequently, this mix spills over with the bacteria and infects the surrounding on the skin, causing inflammation. Now, papules do not contain a pus, which makes them a bit easier to treat. You can utilize over-the-counter benzoyl peroxide treatment. Thanks to its antibacterial properties, it will help the skin's inflammation. To tackle the problem in its core, you can receive the prescription from dermatologists. Depending on your specific cause, they might recommend a topical, retinoid, and antibiotics.
The next type of acne is actually pustules. These are small bumps that we can see bulging out of the skin, and they usually have a white center. The surrounding skin may be red or sort of inflamed, and it actually means that it can be painful to the touch. Ouch. In most cases, pustules like to kind of show up in clusters, and unfortunately, they would appear on your chest, back, but also sometimes on other parts of your body. And while they can be attributed to a lot of causes, one of the top causes are actually hormonal changes. Another characteristic of pustules is that they actually contain a yellowish fluid that you usually call pus. And of course, there is this trend of popping pimples that might be considered satisfying, but we strongly recommend against doing it. The reason for that is that if you pop your pustule, it can actually allow the bacteria to spread around and actually touch the skin that is not even irritated, and the result for that is just more pustules. And rather than doing it yourself, only your doctor can perform an extraction, so it's better to ask for their opinion. And in terms of medication, antibiotics will probably be the most recommended medication for this particular case.
Nodules and nodular acne. Since we're in a painful department of the acne, let's talk about these flesh-colored or red bumps that are lodged deeper under the skin surface. Nodules causing nodular acne are the result of the C. acnes bacteria. Now, with this type of acne, an over-the-counter treatment will not work since those typically act as a surface treatment. Once again, your dermatologist will be the best person to treat the breakouts. They might prescribe prescription strands, benzoyl peroxide or salicylic acids, antibiotics, retinoids. Draining, popping your nodules will be quite painful and absolutely ineffective if you try it yourself. Your dermatologist can instead hand drain the nodules or perform a laser treatment or a chemical peel to get rid of the infected layer of the skin.
The last type of acne that we will talk about is actually the most difficult to treat. We're going to talk about cystic acne caused by cysts. Those are actually the most painful and most severe type of acne, and it's actually the result of an infection deep into the skin layer. And the actual pimples can be recognized as such. They're usually large, usually inflamed or red, and they're actually pus-filled. They're also actually softer to the touch than nodules, for example, because they are filled with fluid. And when they eventually burst, the liquid inside will actually go on the surrounding skin and create an ever bigger infection. If you have cystic acne and the treatment is taking a long time, don't be discouraged. This is actually the most difficult type of acne to treat. As for treatments, your dermatologist might help you fight the cyst with a list of medications. They might prescribe isotretinoid, which are oral retinoids. They might prescribe antibiotics, topical retinoids, or spironolactone, which is actually a medication built to combat fluid buildup. Your doctor might even prescribe you some steroids to be injected right into the cyst in order to combat the inflammation right at the core. Well, after seeing all these different types of acne, the only question that everybody must probably be wondering is, why? Why do we have to deal with this?
Well, the answer can be quite simple. We have broken down the circumstances of each acne type, and we know that in the most cases, acne breakouts happen because of the pores are clogged with oil, bacteria, and dead skin cells. But if that were the only causes, it would be too easy, wouldn't it? Let's take a look at the possible reasons that you might be breaking out. Yes, it's very common to start breaking out during the puberty when the hormone level fluctuates significantly. This concerns everybody, but for women and girls in particular, the resulting hormonal acne can keep occurring even after the puberty, along with the menstrual cycle. You can spot it by looking at the jaw and chin area where it usually appears most. Of course, as we know, types of acne can vary, but hormonal acne will usually produce cystic blemishes and will start deeper in the skin than a simple whiteheads or blackheads.
Another cause is unfortunately stress. There are actually no physiological reason, or we don't have proof that there is any. However, there is an actual correlation between stress and breakouts, so we can't really escape it. Now let's talk about the medications. Some of the medication side effects actually are linked to certain breakouts. If you take the likes of steroids, anticonvulsants, barbiturate, or even lithium, you are actually bound to maybe experience some acne breakouts.
Hygiene and hair products. This goes without saying, but failing to clean your face and wash your hair will result in the buildup of oily deposits on the forehead. They will end up clogging pores, which will end up into the breakouts soon enough, especially if you use hair gels, oils, and waxes. Homemade acne is directly linked to their thick texture, so let's keep it fresh and clean. Always cleaning the pillowcases is also a way to keep off the bacteria.
Now this one might sound a little bit obvious to most of you, but skin irritation is one of the biggest causes of acne. So from wearing makeup to wearing hats, touching your forehead a lot, linked to the other factors can absolutely be linked to acne breakouts.
So with the help of this video, we really hope that we were able to help you to recognize the signs of acne, which is the first step towards treatment and recovery. And always remember, having acne is okay.
And if this video helped you in any sort of way, please do not hesitate to give us a thumbs up so that we can actually reach and help a wider audience. Also, don't forget to subscribe to the Time channel and hit the notification button so that you never miss any of our updates. And we'll see you next week. Bye!